Welcome to this foundational video on the anatomy of the spinal cord, the vital communication highway between the brain and the rest of the body. In the first part, let's explore its structure and divisions in a way that makes complex anatomy easy to understand. The spinal cord is a long cylindrical structure of nervous tissue. It begins at the medulla oblongata at the base of the brain and extends down to around the first or second lumbar vertebra. That's roughly L1 to L2 in adults. In males, it measures about 45 centimeters and in females around 42 centimeters. It lies protected within the vertebral canal, cushioned by the meninges and cerebrospinal fluid. The spinal cord is divided into 5 main regions, each giving rise to specific spinal nerves. Cervical from C1 to C8, 8 pairs of nerves. This region shows a cervical enlargement to supply the upper limbs. Thoracic T1 to T12, 12 pairs, narrower due to fewer motor neurons. Lumbar L1 to L5, 5 pairs, features a lumbar enlargement for the lower limbs. Sacral S1 to S5, 5 pairs. The spinal cord tapers into the conus medullaris around L1 to L2. Coccygeal, a single pair of nerves, the most inferior. At the lower end, we find several key features. Conus medullaris, the cone-shaped terminal part of the cord. Cauda equina, a bundle of nerve roots extending below the conus. This unique structure allows for safe lumbar punctures at L3 to L4 or L4 to L5. Filum terminale, a thin fibrous thread anchoring the cord to the coccyx. Inside, the spinal cord contains gray matter and white matter. Gray matter shaped like a butterfly or hitch in the center. There are anterior horns comprising motor neurons, posterior horns comprising sensory neurons, and lateral horns present in thoracic and upper lumbar areas which house sympathetic neurons. White matter surrounds the gray matter and is arranged into funiculi, anterior, lateral, and posterior. These contain ascending or sensory and descending or motor nerve tracts. The spinal cord gives rise to 31 pairs of spinal nerves formed by the union of a dorsal root, sensory with a dorsal root ganglion, a ventral root with a motor function. These roots merge to form a spinal nerve which then splits into a dorsal ramus, supplies the back, a ventral ramus supplies the limbs and front of the trunk. Each spinal nerve except C1 serves a skin region known as dermatome. The spinal cord also mediates reflex arcs, enabling rapid involuntary responses like the knee-jerk reflex. Blood supply of the spinal cord is critical. The spinal cord is nourished by one anterior spinal artery supplying the front 2/3, two posterior spinal arteries supplying the posterior third, reinforced by the radicular arteries from segmental vessels like the vertebral, intercostal, and lumbar arteries. To recap, the spinal cord is a complex yet beautifully organized structure, central to motor control, sensory perception, and reflex actions. Understanding its anatomy lays the groundwork for exploring spinal disorders, injury mechanisms, and neurological assessments. Thanks for watching. Stay curious and keep learning. Follow us for more high-yield medical videos.